This is the training video for the Nutricia Flocare Infinity pump. We'll go over what equipment you'll need, which will be provided by Valindra. So you get a training manual and a step-by-step guide on the training pump. You have the giving set, a Z connector which will go onto the stand, and the feed will go onto the connector, the adapter, your feeding pump, the battery pack, and your feed. So to set up the pump on your stand, simply find the screw connector on the back and place it over top of this screw and simply screw the pump on. Just tight enough so that it doesn't move, and that's how you set up your pump.
First, you will want to make sure the name of the bottle matches what the dietitian has recommended for your feed. The feed regime is different for each individual. Check the expiry date to ensure the feed is within date. Shake the bottle to mix the contents while looking for any lumps or discoloration. If you notice this, use a new bottle. Take the adapter and the giving set out of the packages. Connect your adapter to the giving set by finding the end of the giving set that has a long cap. Take the cap off and line the end of the tube with the insert of the adapter and turn to tighten. Take the protective cap off your bottle of feed. You do not need to break the seal with any objects. When you screw the adapter onto the bottle, it will automatically break the seal. Now we will go over how to set up the feed on the stand. Take your Z connector and slip it over the top of the stand with the loop facing the back of the stand. Take your feed, and on the top there will be a loop where you can hook it on to the Z connector. Ensure the feed is on the back of the stand and not on the same side as your pump, as it will tip over. After you have hung your feed on the stand, we will now put the giving set into the pump. To open the door, place your finger in between these two lines, press in and lift. You'll loop the purple tube just over the black circle, and you'll just pull and place that part of the tube in, making sure that none of the tube is kinked. Then you'll simply press down on the door until you hear a click, and then you have the giving set in your pump. Now that you've set the giving set into your pump, we'll turn on the machine. You'll go to the on-off button, hold it down for 2 seconds until you hear a beep, and then it will run a self-test. Once you have reached this screen that says volume, you are ready to program your pump. The volume displayed will tell you how much feed you had previously. You need to clear this to allow your pump to reset. Press the button labeled CLR, which means clear. Once you completed this, the pump will change to this screen where it says rate. Rate is how fast the feed will run every hour. This will depend on the regime you and the dietitian have agreed on. For this video example, we will set the rate at 80. To adjust the numbers, use the plus and minus buttons. To increase the number, press the plus button, and to decrease the number, press the minus button. So to go to 80, we'll do the plus sign. You can press and hold it down. If you've gone past, you simply press the minus sign. Next, you will program in the dose. So you'll press the button that says dose equals volume. This is the total amount of feed that you will be getting throughout the day. For this example, we can set it to 800. Again, it's dependent on your own feeding regimen that you will be given by the dietitian as to how much you will be given. Again, you'll want to hold down the plus sign.
to get to 800. If you've gone past, you simply hold the minus sign and go back down. And there you've set the dose. After you've set the dose, you will want to do what we call priming the line, which is pushing the air out of the line while having the feed come through. You don't want to be putting this amount of air into your stomach as it may be uncomfortable. To prime the line or push the air out, we'll now go to the fill set button. So you'll push and hold for 2 seconds. You'll hear a beep and it will say fill set. So you'll notice now that the feed is being pushed through the tubing, and there will be air that will be pushed out. During the fill set function, as your feed is filling the line, it will automatically come to about 1 to 2 centimeters before the end of the tube, which is okay. If you notice that the feed is going right up until the end and it's not stopped, you can press the fill set button again to stop the fill. Once your giving set has been primed or the air is out of your tube, you can now connect the end to your feeding tube. Before you do this, you'll want to flush your feeding tube with water. It's important to do this to prevent blocking of your tube and to rinse out any previous sediments. To take the cap off the end of the tube, you simply squeeze, twist, and pull.
Once the cap is off, you can connect the giving set to your feeding tube. To attach it, line the end of the tube to your own feeding tube port and turn to tighten, just as you have been doing with your syringes.
Once you've attached the end of your giving set to your feeding tube, you can now run your feed by pressing the start-stop button here. So you'll hear a beep, and you'll see there's a run circle which indicates that the feed is going. It will deliver a few drops at a time, so it's normal for the machine to pause. Once your feed is done, it will say end dose on the screen. To stop the alarm, press the start-stop button, and now you'll proceed to disconnect the feeding set from your feeding tube, and remember to flush with water. It is important to flush after your feed to prevent blocking of your tube. Once you've disconnected the feeding set from your tube, you can turn off the machine by pressing the on-off button and holding it until you hear a beep, then the screen will go blank. Again, to open the door, you simply put your finger in between those two lines, press in and lift. And you can take the feeding set out by simply lifting the tubing and lifting off. Once your feed is done and you've disconnected the giving set from your pump, you will throw away both the feed and the giving set. Once the feed is opened, it's only good for 24 hours, so you'll need to throw the feed away daily. After your feed is done, remember to charge the pump. There's a connection at the side here, and you can plug this into your main outlets. Once charged for 6 hours, it will give you a 24-hour battery life. You can also keep it charged as the feed is running. We will now go over some of the issues you may encounter. Your tube coming into the pump may get kinked, as well as the tube coming out of the pump. So if the tube coming into the pump is being kinked, on the screen it will show OCC in, which means occlusion into the pump. And it will give you an example of why that may be happening and how to resolve it. Similarly, if the tubing coming out of the pump is kinked, it will say OCC out, which means occlusion out of the pump. And again, you'll have the reason and the resolution. Nutricia provides this troubleshooting and pump alarm step-by-step guide to troubleshoot any problems you may encounter.